6 early dementia symptoms you should absolutely not overlook. Are you concerned about your brain health or that of a loved one? Today we'll delve into 6 early signs of dementia that you should never ignore. Dementia affects over 55 million people worldwide, making it a leading cause of disability among the elderly and the 7th leading cause of death globally. You might think you're too young to worry about dementia, but changes in brain neurons can start decades before the first symptoms appear. Staying alert and informed is crucial in recognizing and addressing these early warning signs. This article is divided into 3 parts. The 6 early signs of dementia, often overlooked or misunderstood. The 10 classic symptoms of dementia. Recognizing these can help in identifying the condition early. Prevention tips and latest developments. Learn how to potentially prevent or slow down dementia and get updated on recent scientific advancements. If you or a family member is experiencing memory loss, reading this until the end could be crucial. Don't forget to like, share, and engage with this content to help spread awareness. What is dementia? Dementia is a general term for symptoms affecting cognitive abilities such as learning new things, remembering past events, reasoning, paying attention, making decisions, solving problems, and performing daily tasks. It is in the brain where our identity and memories are stored, and dementia attacks this core, deconstructing the person's sense of self. Dementia is not a part of normal aging. While you can live to be over 100 and remain mentally sharp, dementia is a neurodegenerative disease where neurons die faster than in normal aging. Alzheimer's disease is the most common type of dementia, accounting for 60–70% of cases, followed by vascular dementia, 20%, dementia with Lewy bodies, 10%, and frontotemporal dementia, 5%. The impact of dementia. Dementia not only affects the individual, but also places a significant burden on families and caregivers. The progressive nature of the disease means that those diagnosed will require increasing levels of care and support as time goes on. This can lead to emotional, physical, and financial strain on caregivers, highlighting the importance of early detection and intervention. Understanding neurodegeneration. Neurodegeneration refers to the progressive loss of structure or function of neurons, including their death. This process is at the heart of dementia. In Alzheimer's disease, for example, abnormal protein deposits form plaques and tangles in the brain, disrupting cell function and leading to cell death. Over time, this damage spreads and affects various brain regions, leading to the symptoms we associate with dementia. 6 early signs of dementia. 1. Postural changes. Early dementia can cause subtle changes in posture, such as walking with shorter or slower steps, dragging feet, coordination problems, and becoming more hunched or leaning to one side. These changes are often mistaken for normal aging or muscle weakness. Paying close attention to these signs can help in early diagnosis. The science behind postural changes. Research suggests that these postural changes are linked to the brain's control over motor functions. As dementia progresses, it affects the basal ganglia and cerebellum, which are responsible for coordinating movement and balance. This leads to the observed changes in gait and posture. 2. Sensory problems. Dementia can affect depth perception, spatial awareness, taste, smell, and sensitivity to noise. This can make everyday activities like shopping or navigating crowded places challenging. Sensory changes might also include difficulty distinguishing between colors or contrasts, leading to missteps or falls. Sensory changes and their impact. The brain's sensory processing centers, such as the occipital lobe for vision and the temporal lobe for hearing, can be affected by dementia. This disruption can cause the sensory problems observed. For example, changes in the olfactory bulb can lead to a reduced sense of smell, which is an early indicator of Alzheimer's disease. 3. Muscle strength problems. A weaker grip can indicate a higher risk of dementia. An Australian study found that women with weaker grips were twice as likely to develop dementia. Muscle strength is not just about physical fitness, but also about neurological health. The connection between muscle strength and brain health. The connection between muscle strength and dementia lies in the brain's motor cortex. As dementia progresses, it can affect the motor neurons, leading to decreased muscle strength. Additionally, regular physical activity has been shown to promote brain health. So, a decline in muscle strength could indicate a lack of physical activity, which is a risk factor for dementia. 4. Sleep problems. Excessive daytime sleepiness, insomnia, vivid dreams, restless sleep, and other sleep disturbances can be early signs of dementia. Poor sleep quality can also accelerate the disease's progression. Sleep is essential for brain health, as it helps in the clearance of toxins and the consolidation of memories. Sleep and dementia, a bidirectional relationship. Poor sleep is both a symptom and a potential cause of dementia. The brain's glymphatic system, which clears out waste products during deep sleep, becomes less effective without sufficient rest. Accumulation of these waste products, such as beta amyloid, is associated with Alzheimer's disease. Therefore, ensuring good sleep hygiene is crucial for brain health. 5. Apathy. Loss of interest in activities once enjoyed can be an early sign. This change in motivation is due to the death of neurons and changes in neurotransmitters that regulate emotions. Apathy can be mistaken for depression, but it is a distinct symptom of dementia. Apathy and emotional regulation. The brain regions involved in emotional regulation, such as the prefrontal cortex and the limbic system, are affected early in dementia. This leads to changes in behavior and a loss of interest in previously enjoyable activities. Understanding this symptom can help in differentiating between dementia and other psychiatric conditions. 6. Difficulty finding words. Struggling to find the right words, known as aphasia, is a common early sign of dementia. This can affect daily conversations and the ability to communicate effectively. Aphasia can start subtly, but progressively worsens, impacting social interactions and relationships. The mechanisms behind aphasia. Aphasia in dementia is typically due to damage in the left hemisphere of the brain, particularly in areas responsible for language processing such as Broca's and Wernicke's areas. This damage disrupts the ability to recall words and construct coherent sentences, making communication challenging. 10 classic symptoms of dementia. 1. Short-term memory problems. Individuals may remember past events vividly, but struggle to recall recent activities or conversations. This is often one of the first noticeable signs of dementia. 2. Difficulty following conversations. Losing track of conversations, frequently interrupting or asking repetitive questions, can indicate cognitive decline. This occurs because dementia affects the ability to process and retain new information. 3. Mood or behavior changes. Significant changes in mood, such as increased irritability, depression, or anxiety, can be early indicators. Behavioral changes, including agitation or impulsivity, are also common as the disease progresses. 4. Difficulty making decisions. Poor judgment and difficulty making simple decisions can lead to risky behaviors, such as leaving the house without notice or forgetting to turn off appliances. 5. Loss of sense of time. Forgetting the date, time, or even year can cause confusion and disorientation. This symptom can disrupt daily routines and important appointments. 6. Repeating questions. Asking the same questions repeatedly, even after receiving answers, is a common sign due to short-term memory loss. 7. Disorientation. Getting lost in familiar places or having trouble recognizing familiar environments can indicate significant cognitive decline. 8. Misplacing objects. Placing items in unusual locations, such as a phone in the refrigerator, reflects difficulties in spatial awareness and memory. 9. Hallucinations. As dementia progresses, individuals may experience hallucinations, such as seeing, hearing, or feeling things that aren't there. These can be distressing for both the individual and their caregivers. 10. Incontinence. Difficulty controlling bladder or bowels often occurs in later stages as dementia affects the brain regions responsible for these functions. Causes and prevention of dementia. Genetic factors. While there is a genetic component to dementia, it is not the primary cause. Family history can increase risk, but lifestyle and environmental factors play significant roles. Lifestyle and environmental factors. Head trauma, strokes, chronic infections, circulatory problems, excessive alcohol and drug use, poor diet, and lack of physical activity are all risk factors for dementia. Modifying these factors can help reduce risk. Preventive measures. Build cognitive reserve. Engage in challenging cognitive activities like learning new skills, speaking a foreign language, or playing an instrument. Cognitive reserve helps the brain cope better with damage and maintain function. Physical activity. Regular exercise improves circulation, reduces stress, and increases brain-derived neurotrophic factor, BDNF, which promotes neuron growth. Both aerobic exercises like walking and strength training are beneficial. Quit smoking. Smoking damages the brain and increases the risk of heart attack and stroke, which are risk factors for dementia. Control blood pressure and cholesterol. Keeping these in check reduces the risk of dementia. Hypertension and high cholesterol contribute to vascular dementia. Maintain a healthy weight. Reducing visceral fat lowers inflammation and the risk of dementia. Obesity is linked to metabolic disorders that can affect brain health. Manage diabetes. Controlling blood sugar levels is crucial, as diabetes significantly increases the risk of dementia. Alzheimer's is sometimes referred to as type 3 diabetes due to its links with insulin resistance. Improve sleep. Ensure you get 7 to 9 hours of quality sleep each night to support brain health. Good sleep hygiene is essential for cognitive function and the prevention of dementia. Healthy diet. Follow a Mediterranean or ketogenic diet to support brain function and reduce the risk of dementia. These diets are rich in healthy fats and low in refined carbohydrates. Recent scientific advancements, new treatments on the horizon. Recent advancements in dementia treatment have brought hope. New drugs like lanabecestat and donanemab target the beta-amyloid protein and help clear it from the brain, improving quality of life and slowing cognitive decline. These breakthroughs signify that we might be closer to finding a cure for dementia. Immunotherapy. Immunotherapy uses the body's immune system to target and remove harmful proteins from the brain. Both lanabecestat and donanemab are immunotherapies that have shown promise in clinical trials. They represent a significant step forward in dementia treatment. The role of technology. Advances in technology are also aiding in the fight against dementia. Wearable devices can monitor cognitive function and detect early signs of decline. Brain imaging techniques are improving, allowing for earlier and more accurate diagnosis. The importance of early detection. Early detection of dementia can significantly improve outcomes. By identifying the disease in its early stages, individuals can receive treatment and support to manage symptoms and maintain quality of life for longer. Dementia is a complex and challenging condition that affects millions of people worldwide. Understanding the early signs and symptoms is crucial for early detection and intervention. By staying informed and proactive, you can help reduce the risk of dementia and support those who are affected by it. If you found this information helpful, please share it to raise awareness and support those affected by dementia. Remember to subscribe for more health-related content and stay informed about the latest developments in dementia research.